Thank you very much to the National Cancer Society Malaysia for your kind invitation to share my thoughts on silent mentor. It's a slightly twist to the talk earlier, but very closely related, and that's why I'm here to advocate silent mentor program. What is silent mentor? A lot of you may think, is it silence? Do not speak? Yes, they do not speak, but they offer their bodies for teaching, and that is silent mentor. Oops, my slide has gone, but never mind. Cancer and the silent mentor is actually a very kind of a different history that you might thought about when you come to hear about cancer. It's a Cancer Society meeting. What is it about silent mentor? I met my patient sons a while ago in front of a lift in Asunta hospitals when his mother, Madam Osifuri, was admitted to hospital with terminally ill cancer. I treated her many years ago for a colon cancer, which she had been cured, but subsequently she developed sarcoma of the toes and subsequently spread to the body, including at that time to the lung, which was incurable. The question that the patient's son, Mr. Nyo, asked me, Prof, is there anything in this world that can make my mom pain-free? I'm so afraid that my mom has pain towards the end of her cancer journey. Is there any medication that works? Should she see anyone for this treatment? And these very, very important questions. And of course, the easiest thing that I could do is to say, I can refer her to see a palliative care physicians. I can refer her to see an anesthesiologist for pain relief. But is there any other ordinary that you can actually offer? So that's why I'm here today to share with you what I have observed over so many years. And when I first started the silent mentor program in Malaysia, in University Malaya, with the support of Prof. Azad, we were able to do the first fresh cadaveric workshop at that time. But at that time, the cadavers were basically nameless, and they were unclaimed, and we do not know where they come from, and we were actually looking out for bodies across Malaysia, for unclaimed bodies. And we performed the first successful fresh cadaveric workshop in University Malaya at the mortuary at the time. I thought that this wasn't a very ethical way of obtaining bodies. And at the same time, someone knocked at my door and said that a representative came in and showed me a catalog. Said, Prof, you do not know, you do not have to go around the country to look for bodies. Here I have a catalog. I can import this head from America. Oh, you are laparoscopic surgeons. I can just import the body without the head, without the leg, just the abdominal cavity for you. And you have a fresh body imported, frozen from America at a cost. Of course, I thought that was also very unethical, and of course, I sent him out of the way. And finally, we managed to come up with a silent mentor program by knowing the program itself being established in Tsinghua University in Taiwan. And that actually allowed me to visit the Tsinghua University in Taiwan and get to know what the program is about, and was able to bring in that program to Malaysia in 2012 at University Malaya at that time. Yes, if you can help me, I have some problems with my slide. I think you better play from a hard drive. Yeah. So at that time, I was at University Malaya running the supplemental program, and it was an astonishing experience that with my own eyes and my own patients who had cancer and have undergone the supplemental program. And I learned such a great deal from them, from the patient themselves. Went through the journey with them, having cancer, at the same time helping them to become a silent mentor. And that was a very privileged journey, I think. And what I learned from them, I found so meaningful. And that actually was the driving force at the time to make the decision that I want to bring this program to an independent, not-for-profit, sorry, the slide. Yeah. Okay. To bring it actually to an independent, not-for-profit education and research institution registered in 2016 under the Malaysian government as Academy for Silent Mentor. And it offers free medical educations to all students from all universities, because at the time I could see that the benefit of this program that can bring to all medical students in this country. And with that intention, yeah. Okay, it's all right. I think we don't have a major issue with the slide. Adaptations. So I'm just going to carry on, right? And we just have to talk about it. And I think a supplemental program is something that I have learned over the years. It's basically a body donation programs. And when someone they pledge their bodies, including the life stories, before they pass on, so that after they pass on, their body will be donated as a cadaver for a cadaveric workshops for medical students as well as for health professionals for simulative surgery training. And these body donations is based on altruism. Altruism is very important towards the end of the life for cancer patients. A lot of cancer patients, they fear about death. They do not know what will happen after they pass on. In order for them to conquer that fear, they need to be able to let go of the anxiety about death. And what we found is that for patients, it's very good, thank you very much. Right, I'm back to business. Okay, I hope I can cram back my minutes. I can control the slide, can I? I think you just have to stick in that. Okay, my apology, everyone. All right, so we are back to business. The Academy for Silent Mentor, where I come from, actually is an independent, not-for-profit education and research institution established in Malaysia. And it offers free medical educations to all medical students in this country. Our vision is to make a difference to the provision of healthcare with the touch of humanisms and liberal arts through the altruistic teachings of our silent mentors. So our silent mentors donate their body largely based on altruism. And that is very important to us because that is the advocacy. I voluntarily donate my body for the good of others. And that is the altruistic wish of our silent mentors to donate bodies, not for themselves, but for the good of others. And this, for the good of others, is very important concept in this talk, because this offers an alternative treatment to our cancer patients. We refer to eye silent mentor as a good person who holds a good thought and does a good deed at the end for public good with no borders. And we advocate the core value as being truth, goodness, and beauty. And it's important to understand that in silent mentor program, the silent mentor not only just donate their bodies, but they also donate their life stories. They have to let people know about their life stories in order that the students and the doctors can pay respect and gratitude and love towards them before the workshops. And what would you do for our silent mentors in our institutions? We actually offer two types of body preservations. One is through embalmment, the other one is through rapid freezing of the bodies. And before that, the actual workshop itself, we actually have home visits, and the students will have to visit the family members, talk about their silent mentors, and write about their life stories, and prepare presentations to present to the public. And more importantly, during all the workshops that we do, regardless of the participants or the instructors from various countries, they will have to sit down and listen to the student to present to them about their life stories, so that when they operate on the silent mentor, they will know who they are and their life stories, and they will be able to identify them just like their own patients. And this was followed up with initiation ceremony, whereby there is only religious ceremony at a time for the whole program, whereby the family members will congregate together and then pay respect to their loved ones and have a final viewing of their face before the starting of the actual workshop itself. And during this time, based on the religion belief, we have a religious ceremony to pay respect, and all students will join in to that ceremony by standing still, having 3 bows to them to pay respect. And this will followed by workshops of 7 to 14 days, and finally cumulative in a coffining, gratitude and setting off ceremony with cremations and sea burial at the end, if the family chooses to have sea burial or eco-burial. And of course, over the years, we found that the value of this program that we actually introduced now palliative and end-of-life care to the family members. And this is kind of liberal arts education that we offer to our medical students. And it's actually we actually have a FSM student council, and it's a student-centric learning. We advocate volunteerism, and we train our students to be the leaders for the futures. And in that, they actually develop a personal development system that they can monitor their own progress. And current active membership was around 150 students. These are all our volunteers, and they come from all universities, including University of Malaya, UKM, UPM, USM, UPNM, UNIMAS, Taylor's, Utah, IMU, Monash, Newcastle, Penang Medical College, and many power universities, and many more. And we were not able to show you the slide. I'm not sure why, but I just have to flip through this. And I think that will. I'm not sure about the computer. Yeah, I think for the interest of time, what I can share with you is, it doesn't work at all. I'm not sure why all the slides are not projected. It's okay here, but not projecting. I just like to, because the slide doesn't really work, so I'm
reason why I
need to pay attention to the face of the slide mentors.
After reading the brochure that my sister gave me the application form, I find that it's doing good for the next generation to come, because I've been hearing stories like the doctors, right? Now the generation doctors, they do make mistake during surgery, so maybe they cut the wrong part or what. So I feel that maybe they don't have enough bodies to do practice on. So with my body, hopefully after I die, I can still benefit them to learn more about body parts, and so that they won't do any mistake during the surgery. Use whatever that I've given to you well, don't abuse it, and take it as learning, yeah. And I expect the body, even though physically I'm here, but inside I'm already somewhere in heaven or what, but I'm there still watching them using my body well. So that's what I really wish for. Most of them, they feel that they can't accept it yet. They say that I die already, then my friends will come and pay respect, they'll be asking where's the body, so they still cannot accept it. And some people believe that the soul is still inside the body for don't know how many seconds or how many minutes. They feel that it's kind of weird to be put in taken away just like that. So for me, my understanding of death is that this is just a temporary vessel that is being loaned to us by God. So once this vessel has already fulfilled its duties, it's time to go back to God. My message to the public: try to understand more. Talk to your head of religion, yeah, to understand more what is a body. Talk to the silent mental people, yeah, the founder or the committee member. What is this program all about?
So this is Jacqueline, and she had this video taken just before she passed away in 2017. And what I would like you to look at was actually look at her appearance, think about this patient who actually has terminally ill with breast cancer spreading to bones, livers, and stomach. And just before she passed away, despite knowing that she had a death sentence, but she can still accept that and willingly to donate the body and be able to have a transformation of her mind so that she can achieve peace towards the end after they pass on. So this is what I observed in those cancer patients who have kindly donated their bodies for the silent mental program. And this is Madam Manjit, who passed away this year, and it was when she actually received her donor card, and according to her faith, it's actually very difficult to donate body, and most of her communities and her spiritual leaders were actually against it, and she actually steadfast in her commitment to donate her body, and she was able to accept the fact that she is actually terminally ill and decided not to undergo any further medical treatment, but actually receive at the end a peaceful death towards the end. And what I've seen, this is actually Madam Ossie Fury, and this is what I'd like to share with everyone, that this is the patients whom I talked about earlier on, that she actually, the son was actually worried about the pain control, And what I share with you is that from my experience with these patients, none of them actually have taken any pain relief. They do not take morphine. They didn't even have paracetamol. And yet towards the end of their life, they were actually pain-free. And in fact, I have one patient who had a tumor growing all over the body, including her abdomen, with the tumor growing out from her ileostomy. You can visually see the tumor. And with the tumor going out through her vagina, from the abdominal cavity, the whole abdomen was full of tumor. And yet, she did not have any pain. I did not believe it, and I asked my colleague to actually a palliative care physician to offer a second opinion in case this patient was so attached to me that she doesn't want to let me know that she had pain and hide her pain. But in fact, my palliative care physician colleagues came up and said, don't ask me why. She did not have any pain. She did not need any morphine or any medication at all. And she was able to tell me exactly when she is going to pass away. And I still remember that night. Now I visited her at 12 o'clock in the morning and said, Prof, go home and sleep, you know. And she sent her husband home as well. And that morning at 3 o'clock in the morning, she passed away peacefully without having any medications. And this is what I could see in my patients who donated towards the silent mentor program. I do not know why. I'm still doing research in this area and still looking at how this change of mental state is more like psychotherapy, change of mental state that actually offer a pain-free journey to this patient towards the end. And we also started with another program called Rapid Tissue Donation Program, whereby the silent mentor can actually donate their tissue after they pass away. But they have to come to our center within 2 to 4 hours of their death so that we can rapidly harvest the tissues. And these patients, Lim Sok Heng, our silent mentor, actually had a large, you can clearly see on a CT scan, a large intra-abdominal tumors. At first had problems in making the right diagnosis, and having had a second opinion, and we finally diagnosed it to be a dendritic cell sarcoma, follicular dendritic cell sarcoma. And next slide, please. And we actually harvested the tissues and be able to perform a next generation gene sequencing. And this is what we can see from the tumor itself. And next one. And from that, we actually found out that this patient, the silent mentor, actually have 3 different sites of mutations in the genes that might be of some clinical significance in the future for future patients, not for herself, but for future patients. And these patients, when she was diagnosed to have these tumors, and she came to me for a second opinion, asking me if I could remove that tumor for her. And I told her that it is not possible to remove it because it's too advanced. And I looked at her and I asked, in the end, I thought that it's my duty to inform her that if you would like to find out whether this tumor can undergo final analysis, and of course at this time, it's unethical to obtain tissues from you from various sites of the metastasis to find out your genetic pathway, how the metabolic pathway of the tumor spread. Would you be considering donating your tissues after you pass on so that more patients can benefit from this and understand about the pathway? And she looked into my eyes and said, yes, I want to do this. This is the least that I can do for myself and for my future patients. And she greatly signed the program. Of course, we need a full consent from the family, and having had done the family visit, and she finally signed the consent with the support of her brother, who is a pathologist in Canada, who told her over the phone in tears that he would follow the footsteps and donate his body towards a medical school in Canada. And that evening, she passed away peacefully because she had done the last deed for the good of mankind. And I think this altruism offers peace and allowed them to relieve the stress of death and the fear of death. And I think this allowed them to detach from the body as well, so that when they pass on, they can go into another world, where in their mind, spiritually, they could actually transcend to another world without further regrets. And this altruism, I think, offers the best quality of life to our cancer patients. I didn't show you some of the research paper, but some research paper suggests that altruism towards the end of the life for cancer patients actually correlate with the quality of life towards the end. So I think there is still a bigger room for research in the future, and that these are our partners who have signed MOU with us, including the Royal College of Surgeons of Edinburgh and Glasgow as well, and the Ireland, which is on the paper as well. And these are our partners across the world and also within our country as well. And so there are few issues that we need to address from what I can observe, and I think we are looking to carry out further research in this area. And should anyone interested to join us for this meaningful journey, you're most welcome to contact me, and then we can look into how we can collaborate in this field, especially Professor, in the field of psychology. And there's so much work to do to study these donors, why they actually donate the body, does that improve their quality of life, the psychosocial. And of course, for Muslim, there may have certain challenges in pledging your body for body donation, but I think rapid tissue donation would be an option, because with the rapid tissue donation, we would be able to allow a burial within 24 hours. Thank you very much. Thank you. Sorry for the hiccups.